With me now is Dr. Dina Kulik. She's a pediatrician in Toronto. Doctor, good morning. Thank you for being with us. So it seems like schools are going to close or remain closed until the fall. What's your view? Do you agree with that?
I think, like many other physicians, pediatricians, healthcare providers, I feel strongly that schools should be the very first things to open and the last things to close. Kids in schools, that's their work. So if we're feeling the economy needs to be opening and people need to be back to work, this is our kids' work, and we need to be putting them first. It's paramount.
But then there are other doctors who are saying, and epidemiologists, that we need to be worried about the variants and the spread of variants. And if we bring kids back into class too soon, that means we're going to see cases go back up again heading into the summer. So how do you respond to that argument?
So the Ontario Science Table does show that case rates will go up. We have this curveball of the VOCs always. How much, threat do these pose? We know kids are staying quite healthy through the pandemic. No matter what VOC we throw at them, they stay quite healthy. Now with rising vaccination rates, both amongst the adults, the administrators, the teachers, the educators, as well as a lot of kids that are 12 years and older that are getting vaccinated, the schools are going to be a safer place. And we've learned a lot in terms of minimizing class sizes, masking, spending time outdoors, now vaccination. If we could increase the ventilation, we can keep the schools even more safe and keep our kids in schools learning and socializing. We know a lot of kids are suffering from poor mental health right now. Eating disorders have gone up, suicide rates have gone up, a lot of significant mental health concerns, and our kids do much better when they're in classes.
Doctor, what do you think will be the long-term impact of virtual learning?
I'm not sure I'm worried about virtual learning per se as an entity. More, I think it's important that kids continue to socialize, they continue to move their bodies, get outside. We are finding rising rates of obesity and other sequelae from that because kids are sitting more, they're not interacting as much, they're not moving around as much, they're certainly getting less exercise. So the screen I'm not as worried about per se as what are they doing in their lifestyle as a whole. And even if our kids are learning at home, we can minimize the burden of this.
Doctor, thank you so much for being with us. Dr.